Most welcome, folks. Today, we're diving into a fascinating study about the body composition of preschool children. Specifically, we're looking at differences between those born at term versus late preterm. It's titled Body Composition of Preschool Children Born Term versus Late Preterm, a follow up study of two birth cohorts.
That sounds interesting. So, what exactly were the researchers trying to figure out with this study?
Well, the main objective was to compare the body composition of children born at term versus those born late preterm when they reached preschool age, which is around 3 to 5 years old. They looked at things like fat mass, fat free mass, and their respective indices.
Got it. And how did they go about measuring body composition? What methods did they use?
And they used air displacement plethysmography, or ADP, which is a technique that uses air displacement to measure body volume. They used a BOD pod machine. This method is safe, accurate, and non invasive, making it suitable for young children. They also collected anthropometric data like height and weight.
Okay, that makes sense. So, what were the key findings of the study?
At birth, the late preterm infants had lower fat mass, fat free mass, and their indices compared to the term born infants. However, and this is the interesting part, by preschool age, there were no significant differences in body composition between the two groups. They were comparable.
That's surprising. So, even though the late preterm babies started with lower fat and muscle mass, they caught up by the time they were preschoolers?
Exactly. The study also found that the change in weight for age Z score from birth to preschool age was positively correlated with fat mass percentage in both groups. This suggests that growth velocity plays a role in shaping body composition, regardless of gestational age.
I see. Did they find any other factors that influenced body composition?
In the term born children, they found a positive correlation between parental BMI and the child's BMI, and between maternal BMI and the child's fat mass index. However, these associations weren't observed in the late preterm group, but the authors mentioned that the sample size was small, so these findings need to be confirmed in larger studies.
Interesting. So, what's the main takeaway from this study?
The study suggests that late preterm infants, despite having lower fat and fat free mass at birth, can achieve comparable body composition to term born peers by preschool age. This implies that optimizing growth and nutrition in the early postnatal period for late preterm infants may not necessarily lead to excessive fat gain that persists into childhood.
That's reassuring. But did the researchers mention any limitations to their study?
Yes, they did. The sample size was relatively small, which limited their ability to perform sex stratified analyses. They also only included late preterm infants, so the findings may not be generalizable to infants born before 34 weeks of gestation. Additionally, they didn't assess abdominal or visceral fat separately, and they lacked data on environmental factors like water, sanitation, and hygiene.
Okay, so there are some things to keep in mind when interpreting the results. What about future research? Did the authors suggest any directions for further investigation?
Absolutely. They emphasized that even though body composition was comparable at preschool age, differences might reemerge later in adolescence or adulthood. So, they recommended long term follow up studies to understand the potential divergence in body composition and metabolic profiles between term born and late preterm born individuals as they grow older. They also mentioned the need to identify risk factors for any potential adverse outcomes.
That makes sense. It's important to see if these early similarities persist over time. So, to summarize, the study found that late preterm infants can catch up in terms of body composition by preschool age, but long term monitoring is still needed to assess potential later life differences.
Exactly, and the study highlights the importance of considering growth velocity and parental BMI as potential factors influencing body composition in children. It also adds to the limited data available on body composition of Indian children born preterm.
Well, that was a really insightful discussion. Thanks for breaking down this study for us.
Hey, you're welcome. It's fascinating to see how early life experiences can shape our health outcomes. Thanks for listening, folks. Until next time.